This is Adrian Hart with your Southeast Colorado News on seconews.org. We're here with Arkansas Valley Communities That Care. Dee Leyba, good morning, Dee.
Good morning, everybody. Good
I guess
Adrian.
I didn't really give your title. What's your title with AVCTC, and you want to tell us a little bit about it?
Sure. I'm the program director, and Arkansas Valley CTC is a program within the Otero County Health Department.
Okay.
And CTC is a community-wide model for systems change that comes from University of Washington that's housed through the Colorado Department of Public Health and Environment.
Okay.
Under their Communities Organizing for Prevention
Okay.
department, or
Yeah.
that area.
Somewhere in there. It
Yeah.
sounds pretty complicated. But what it's really about is local impact.
Yeah.
And really starting from the beginning on building that impact in the community. So you guys are kind of resetting after COVID, shut everything down, and we had one orientation meeting, and I'll tell you, it was a full house.
It was a good meeting, yeah.
Yeah, do you want to tell us a little bit about the organizations that are already involved and going to show up to the next orientation meeting?
So when we create our coalition, or we have key leaders, which is an advisory council for us, there's usually folks that are in charge of like budget, resources, policies, and that's who would attend the key leader orientation. But it's usually people that fall into the sectors of like judicial, schools, courts, public health, even our faith-based organizations, everybody.
So with churches, schools, government. I mean, that's not everybody.
No.
But that's a huge segment of our leadership roles in the community.
Yes, and then teaching everybody how to combine resources and work together. So maybe even breaking down silos, because if you work in government, then like your grant has to work for your work. But if there's a way that we can combine what we can do and not duplicate things, then we'll have a bigger impact on our community. And our goal is always we're skill building and capacity building so that we are creating a safer environment for us to grow healthy children, and then they'll become productive members of our society. And that's the goal.
So you're talking about a root fix.
Yeah, so we're data driven and then outcomes based. So we will go through our local data, and the Healthy Kids Colorado survey is the big one that we use so that we can get local data. And we depend on the schools to give that survey, but you know, it's up to them. And then we'll analyze what information that we have, and then come up with there's a set list of risk and protective factors, and then we'll create those priority risk and protective factors to focus on. But in the end, the goal is to help youth make healthier choices and be more connected to their community. And then we're also like trying to help with preventing substance use and misuse, because they're underage. But for us, youth is 9 to 25, so it depends. We just want to make healthier choices, less risky behavior. But we want to look at things like mental health, what stresses kids out, anxiety, things at home in their built environments, friends, family. Like, what are things that are making kids want to take more risks in? I mean, there's a difference between healthy risk and then things that are dangerous. And we want to take a look at that. So we do look at the root cause, like you said, and then just try to make it so that everybody's on the same page and we're all working together, these organizations, these community organizations, so that we are making a bigger impact and all moving in the right direction. So my favorite example is like
at this stage, it sounds to me like you guys are in the map making process.
Yeah, so we're going to have another orientation in Bent County. We'll start there because we cover Bent, Crowley, and Otero.
Perfect.
And then we'll have more information because we'll go through each county. And then we'll have that information shared out more. But like to give a bit of like a
better
visual
scope of the organization.
Yeah. So if you can imagine, I don't know if you watched Finding Nemo.
Okay.
And you know the part where there's they're all caught in the net, all the fish. And then Nemo was like, I can do this, Dad. And he's like, well, listen to my kid, because we always want to make sure we include youth voices.
And they convince the group to swim down.
And then once they all,
the net.
yeah. And so when we swim down together, or we're working together,
Right.
that's really what a community-wide impact looks like. So that's what we're doing, is we're trying to get everybody to swim down.
Okay.
In a way, yeah.
Yeah, very cool. Trying to get everybody to, we're going to analyze the problems affecting our community and make a map towards fixing those problems.
Mm-hmm.
And even though your organization isn't entirely a youth-based organization,
Right.
you guys are starting from the ground up because it's easier than fixing problems as adults. Right?
Yes. Yeah.
I mean, I'm an advocate for counseling and mental health services. We have a lot of advertisers that actually provide those services. But if we start when they're kids, and like you said, control those risky behaviors, maybe that's just giving opportunity to have behaviors that aren't risky at the same time, right? I remember being a teenager.
So we provide pro-social opportunities in the community, which is where that comes into our partnership with having interns.
Yep, exactly. So we're going to talk about that coming up on Seco News, and you guys can find out how you can help contribute to the news and help us in our map making process, really. That's what we're doing. We're going to gather the news and we're going to lay it all out so the whole community can read it, including Arkansas Valley communities that care. And we're going to teach you guys some great skills for those younger folks, age 15 to 25, that want to be involved. So we'll get back to that in just a moment. With Arkansas Valley Communities That Care, with your Southeast Corridor News, I'm Adrian Hart.